Good morning. My name is Marcy Jo Kutzel. I'm the Public Health Nursing Director, and we're here to update you on the coronavirus activity and our plans in Trinity County. Testing numbers as of today, total persons tested 67, 64 are negative, and 3 are pending. The research is bearing out that there may be sufficient quantities of virus in droplets to transmit illness from asymptomatic persons to others, and that this may occur during ordinary speech. There is still much research to be done. For example, what concentration of virus is needed to infect someone, how far droplets can travel, what effect air motion in a room has on droplets, and how fast they settle out due to gravity. Once again, as we learn more about the nature of this virus, it is vital to continue the aggressive strategies of social distancing, quarantine, isolation, and implementing the use of face coverings when out in public or around others to prevent community spread. Face coverings can help prevent the spread of the virus from asymptomatic persons to others. Cloth face coverings do not protect the wearer from becoming infected from others. As demand for medical grade masks and respirators outpace production, we ask again that the public assist us in our need to preserve these essential items for our healthcare personnel and frontline workers in essential services. At this time, our critical access hospital is testing those that have symptoms consistent with COVID-19 and require hospitalization, those that are healthcare workers, and those living in congregate settings. This testing protocol is consistent with the CDC recommendations for Tier 1 testing. Our clinics have implemented testing protocols consistent with Tier 1 and also include provider discretion, in that if a provider in their clinical judgment has serious concerns that a patient may have COVID, they can, of course, collect those specimens and then submit for testing. Currently, we do not have testing availability beyond what we are currently doing due to lack of testing kits and limited sample collection materials. We are working with a variety of partners to implement expanded testing once supplies become available to support that. Our public health branch has established a dedicated line for the public. That number is 530-623-8235. Once again, 530-623-8235. This is a message line only. We ask that the public continue to utilize existing information resources, such as our website at trinitycounty.org, CDC website, CDPH website, and our Office of Emergency Services phone line. The Emergency Operations Center phone line is 530-623-1116. This dedicated line is to ensure any inquiries from the public related to COVID-19 public health issues are responded to in a timely manner. We will respond within 24 hours. We want to reiterate any specific health concerns should be directed to your healthcare provider, and we ask that the public do not use this phone line to report violations of health orders. Those calls should be directed to the EOC at the number provided. In closing, it is essential that we continue to adhere to the health officer orders and public health guidance currently in place. The Public Health Branch, Office of Emergency Services, Environmental Health, and our county administration are operating under these assumptions. Number one, without expanded testing, we do not have a full picture of the COVID-19 activity in Trinity County. Number two, the longer we can put off community spread in Trinity County, the greater the chances of having the resources we need to surveil and respond to the virus in our community. And number three, now is not the time to loosen existing strategies to hold off the community spread. Thank you so much. And I'd like to introduce Ed Presley, our Office of Emergency Services Manager.
Thank you, Marcy. Good morning, everyone. My name is Ed Presley. I'm the Emergency Operations Manager for the county, and I have a few updates. The EOC is activated at level 2. There are currently 18,309 confirmed positive COVID cases in California. There have been 492 deaths. Tests conducted statewide is 177,600. Humboldt County has 50 positive confirmed cases. Shasta County has 24. Siskiyou County has 4, but I'm aware that 3 of those have since recovered. Tehama County has 1, Mendocino County has 4. Currently, we have no confirmed COVID cases in Trinity County. The EOC operational period objectives for this next week will be to provide effective communication to the public, communicate and coordinate with county partners and stakeholders, monitor and ensure housing plan for homeless in need of quarantine or isolation is on track or complete, ensure the economic development unit is supported, conduct fit testing as appropriate for county staff, monitor for unmet needs around the county. Our situational update: the Emergency Operations Center continues to support public health and Trinity County partners through the multi-agency coordination group to ensure communication and coordination of efforts for timely and accurate messaging to residents. Updates are also provided to the state through communications daily with Cal OES. We have a logistics section set up now in the EOC, consisting of a housing task force unit. This housing task force unit was created to establish procedures for homeless COVID patients in response to Project Room Key, which you may be aware of. This unit will also provide and guide potential future funding streams into the county for non-congregate housing, should the need arise. The Economic Development Task Force unit, which is under logistics as well, is an economic task force that was created under logistics to specifically address the challenges of small businesses and what they're having in Trinity County. The operations section, we have recently stood up our fit testing program. A countywide respiratory protection plan has been approved, and fit testing for N95 masks has begun for county staff, with a priority to those essential employees who may be required to be within the 6-foot proximity of clients. That's the end of my report. Christy's up next with environmental health.
Good morning, everyone. Christy Anderson, Trinity County Environmental Health. First, I wanted to start with giving my deepest appreciation to all the businesses out there working hard to protect the public by either remaining closed if non-essential or putting safety measures in place to protect customers and employees. Second, I wanted to address consumers. Because we all have a role in the prevention of COVID-19, and more specifically, I would like to address grocery shopping, because this has been a topic of many concerns this week. And I wanted to give you some quick tips. 1, we have 3 grocery stores in Weaverville and 3 grocery stores in Hayfork. Scout the parking lot. If there's a lot of people in the parking lot, choose a different grocery store. 2, only visit the grocery store when absolutely essential. Try to shop for a week or a little more at a time, but try not to take more than what you need. 3, limit your shopping crowd as much as possible. Try to shop alone. Kids, I know my kids will touch everything in the store, so if you can, leave your kids at home. But also it helps with crowd control and limits the numbers of people that are shopping. Number 4, social distance in the store as much as possible. If everybody is grabbing milk, avoid the milk section. Go take care of the rest of your groceries and then come back to the milk section. Give yourself space everywhere. Give others space. Number 5, try to inspect foods such as produce with your eyes rather than your hands. It's important not to touch everybody else's potential groceries. Number 6, give yourself a lot of time before you go to the grocery store. That way you have time to get what you need, social distance, walk around the store, and avoid those crowded areas. Number 7, be aware of the store's arrows and X's and lines that they are trying to provide to help with social distancing. Number 8, try not to crowd the checkout stand. Be mindful of your position and others. Don't put your groceries up there till the person in front of you has their groceries off of the counter. And number 9, remember that stores are working very hard to get the products out to the customers. And with this influx of customers, the shelves become empty faster, making workers have to come back out there and stock them. Give those workers their space so that they can fill those shelves back up for you and so that you can continue to shop. Let's support our grocery stores in Trinity County and realize that they are trying to make your experience a safe one. But we as customers, we have our roles too. Thank you so much. I would like to bring Marcia back up here for questions.
Do we have anybody on the line for press? We do not.
It looks like we don't have any questions, but I'm just going to give some additional information while we wait to see if there are any press questions that come through. One of the things we want to do with this event is we'll be doing this weekly to allow the press to reach out in a collective way and get answers to their questions to ensure that accurate information is being put out in the news around Trinity County and the coronavirus activity in our county. There are some recent developments that I think the public might have some questions about, and I'd just like to briefly mention something about that. So the FDA has a program called Emergency Authorized Use. What that is, it allows the FDA to strengthen public health protections around CBRN. CBRN stands for chemical, biological, radiological, and nuclear threats. These EAUs are important during the coronavirus in that it's a way to rapidly test medical therapeutic measures. So you may see the term EAU associated with things like hydrochloroquine. I think that's been in the news recently. The key to the EAUs is essentially their purpose is to make sure they can be used in diagnosis, treatment, or prevention of life-threatening diseases or conditions. This does not take the place of clinical trials that vet medical therapeutics because we don't want to do more harm than good. So I wanted to just touch on that briefly. The other thing I wanted to mention is that there are accelerated treatment programs around coronavirus, and I would recommend that you all go to the FDA website. If you go to the FDA website, you can search for emergency use authorizations, and there's a tremendous amount of information on that website about the therapeutics that are being tested and trialed. So that's really all I have. Do we have any questions? All right, so we will convene next Friday. We would like to...
Someone just joined the line?
Yeah, I just joined the line. Dan Brenke from KQED in San Francisco.
Okay, wonderful. Actually,
we have a question.
If you have a question, let me get you close to the microphone and please ask your question.
Okay.
Go ahead,
Ready to
Dan.
go?
We are ready.
Okay, so Dan Brenke from KQED in San Francisco. Hey, listen, we followed the health order that was pertaining to people with second homes in the county and asking people to self-quarantine and sort of use common sense social distancing measures. I'm just wondering how that order has been playing out, whether there have been any concerns in the community about whether it's been effective. That's the first question.
So I'll let Christy at Environmental Health answer that question.
Okay.
So I believe we are getting some compliance with that, to the fact that, you know, a lot of facilities are calling us first before they accept out of the area customers. But also, you know, we are receiving a lot of complaints, so, you know, it was effective in both ways. We're getting information and we're able to give that information. Thank you.
Okay.
If I may, I just want to add one thing.
Answer. I caught the gist of it. There was a press release from the county the other day that made it sound like there might be some rumors going on about, positive cases in the county. I mean, how are, I talked to Ed Presley, I guess it was a couple weeks ago now, about the situation up there. I mean, are people, and I guess you said something earlier in this session about, it's not the time to sort of relax, vigilance about what's going on. How are people dealing with the sort of the orders to maintain physical distancing? Is there any resistance to that, or people pushing back against it at all?
Well, let me just say let me answer the first part of your question, and then I'll let Christy come back up and answer the second part. So thank you for that question. So in essence, we are unable to get the testing supplies that we need to be able to broadly test. And until we are able to expand testing, we are not really able to create a picture of the coronavirus activity in Trinity County. So it is vital that we get testing supplies to do that. One of the things we're doing is we're working with providers to expand testing once those kits and materials come available. In the meantime, we are asking our public to adhere to those strategies in place. And here's why. Here's essentially why. In a pandemic this size, it's unprecedented. The resources are being used up faster than they can be produced. So what we're trying to do in Trinity County is buy sufficient time between now and community spread to ensure we have the resources that we need to be able to strategically screen and target appropriate interventions to do that. We understand that that this is challenging. We get that. However, it's so essential that we all do our part. And the other issue I wanted to mention too about going out in public, it's now shown that cloth face coverings may help prevent those that are not infected from spreading to others. And so that's a new recommendation that we are putting out there. The other thing that's key is if you pay attention to the national news, we need time for other testing to catch up. For example, serology testing, being able to understand who has the antibodies to this. And what does that mean? Does that mean they're immune? This is not going away, all right? This coronavirus will be around for a while. And until we get a vaccine, we've got to be really smart about what we do and how we approach this. So I'll let Christy, if you wouldn't mind repeating the first part of your question, or excuse me, actually it'd be the second part about compliance.
Well, I do have a follow-up from something you just said, so if you're still there.
Yeah.
And that is, you mentioned the lack of testing supplies. And Governor Newsom and others have been, all the way up the chain to the top, have been talking about testing and availability of testing. It's been recognized there have been problems here in the state. Are you still having problems getting materials from the state, or, are you trying to attract private labs, private testing services to come in, which I know have been operating in some counties? Because when I look at the daily reports from around the state, and especially the more rural counties like Trinity, there are very low numbers of tests being done compared to, if you go to any of the big, more urban counties. It's not surprising because of the number of people, of course.
Right.
But I'm just wondering whether that lack of testing also has to do with what you're saying, the lack of supply.
In a nutshell, yes. We're making strategic decisions based on the supplies that we can get. Right now, we've sent the request for test kits and specimen collections. They've been forwarded to procurement at the state and federal level. And so unfortunately, yes, we're having to make decisions around testing based on what is available to us. Something that's really critical is that Trinity County is a rural frontier county. It has one critical access hospital. We're working with partners to ensure the appropriate disposition of patients, either those with other illnesses, not COVID. So the testing right now, priority in the hospital is making sure they're testing people that will be hospitalized. And when I say testing, I mean collecting the specimens. We don't have the ability to do tests in Trinity County. We're waiting for those kits so that we can start to stand up our local lab here, our local hospital lab here to do that. So in a nutshell, that's where we're at.
Okay, and in terms of, you say that you've asked state and federal sources for these. I mean, do you have anybody, are your legislators pitching in, trying to help? I mean, and who exactly are you appealing to? Is this the Governor's Office of Emergency Services, or who exactly are you going to try to get help?
So we are, I'm going to have Ed come up here with me to answer part of this question, our OES manager. Because here's what we're doing. So in any emergency, there's a system in place to be able to respond and procure resources based on that system. So we have a medical health operational area coordination program. So the process is you first look within the county, then you go to the region, then you go to the state, then you go to the federal government. But when you're dealing with a pandemic of this nature, again, I can't state this enough, and it cannot be lost on us. This is unprecedented. That cannot be understated, because those chains, those normal chains, in situations that don't overwhelm the state and the federal government, nationally and globally, those chains of procurement work very well. This is unprecedented. And I'm going to let Ed speak to how we work with the Office of Emergency Services. And thank you so much for your questions.
Yeah, you're welcome. Thank you so much for your answers.
Okay, so the way the process works is it gets ordered locally, and then it goes to the MOOC, which is medical ordering, medical health operational area coordinator, and then she goes and sends that request to the region, which is the regional medical health coordinator, and then if she can't fill it at a regional level, then it will go to the state level. So since this is a public health spearheaded event, basically everything that gets ordered will be going through the MOOC and through the medical health side. If they lack anything, because I have to report on everything that's done as well to the state, so if they lack anything, or if they're hitting roadblocks and can't get something filled, I can always take it up to Cal OES side, which I have to report to daily to let them know what's going on in our region as well. But this is working off of an assumption that we actually don't have any positives here in the county, and so they're not going to prioritize us the same as they would, say, LA County or San Francisco County. So our testing kits here, they all get, when someone gets collected, they have to go to Shasta County to actually be tested. So hopefully we'll be able to get the testing capability here soon, but as of right now, we do not have it.
Okay, and I'm just looking at the county website. I mean, so it says 63 negative tests so far, one test pending. Those are tests where specimens were collected there in Trinity County someplace and then shipped over to the labs in Reading someplace.
Correct.
So that's correct. Let me clarify. So what we do in Trinity County is we collect the specimens, and then we send them either to a commercial lab, LabCorp, Quest, or we, if they're tier 1, meaning Shasta County Public Health Lab will only take specimens that meet a specific criteria. And that criteria is they'll be hospitalized, they have symptoms consistent with COVID. So I just wanted to clarify that. Did you have another question about testing that I haven't answered yet?
I asked about compliance with the shelter at home, or however you're
Yeah, you bet.
And so that's one other question. And then I did, Ed mentioned something about the homeless population up there. I also wanted to ask about that.
You bet. Let me
So
turn.
whatever order works for you guys.
You bet. No problem. Let me turn it back over to Christy, and then we'll hand it off for the homeless question.
As far as compliance goes, the majority the vast majority of people are doing the social distancing and following the health orders. However, do we have some people skirting around the rules, trying to get around them? Sure we do. And we address those as they come, usually by complaint.
Okay. I mean, a public complaint that something's happening that perhaps shouldn't be?
Correct.
Okay, all right. There haven't been any arrests or anything, have there?
No. Actually, let me refer to the sheriff on that question.
Okay.
Good morning, Tim Saxon, Sheriff, Trinity County. We've not had any enforcement action taken with regard to any violations with this. Obviously, with the governor's order, this is a misdemeanor punishable by either arrest or fine. I've had consultations with the district attorney in Trinity County. We have come up with a protocol to address this should it get to that point. At this point in time, however, my office, we've made the determination that education and compliance is the best avenue to take at this time, and that's what we've been doing. Our protocols are in place. We have developed a notice of violation. If we get to that point, we will go out and investigate this and serve any people necessary with the notice of violation and follow up from that point forward if we have to.
Christie alluded to the fact that there may have been, there may have been complaints. Are you getting complaints from the public about stuff that maybe shouldn't be happening in terms of gatherings or that kind of thing? And can you put a number on that if you have gotten complaints?
We get calls in periodically. We are not documenting those at this time. We are following up as we need to. I don't have any firm numbers.
Okay, all right. Much appreciated. Thank
You betcha. And who did you want Ed next,
Oh,
right?
and I think I have one more question for Ed Presley.
All right.
Thank you.
All right, I'm here.
Well, so I understood you to say something that there had been some action or measures taken to make sure that, I don't know, homeless population in the county is being accounted for during this time. It went by fast, and I didn't quite catch what you were saying about that. Do you recall that?
Yes. Well, the homeless population is not being accounted for. What we're doing is we're on tap to receive possibly some grant funding for Project Room Key, which is a state funded program, so that if we get to the position that we need to, we can.
Okay, and what does that program involve? Sorry, I may have cut out there. What does that program Room Key involve?
No, I heard your question. Basically, it's state funding to be able to provide housing in a temporary manner to a homeless person that has tested positive for COVID.
I see. All right. Do you have does the county have any notion of how many homeless folks you have up there?
You know,
Is there like a point-in-time count or something like that?
I don't have that number in front of me. We can get back with you though.
Okay. Ed, I have your email address. I'll shoot you an email about that.
Okay.
All right. Well, listen, thank you. You've all been very generous with your time. I really appreciate it.
Thank you for those questions very much. We will be holding a press, if there's no other questions. All right, we'll be holding this press conference every Friday. And if the press have any questions, they can submit those via email to the email address provided. Thank you so much.
Okay, thank you. Have a great day, you guys. I mean, all of you.
Thank you.